We want to get back to that COVID-19 news conference we told you about at the top of this newscast.
Harris County Judge Lina Hidalgo gives us a COVID-19 update on the mandatory mask order that went into effect today. Let's listen in.
Who has been a constant presence as I've been giving these updates both in this and other issues. And so I want to say to his wife and his daughters and to the entire ABC 13 team, on behalf of Harris County, thank you for you. Know that you are loved, that you are appreciated, that your work changes lives, and that Willie will be deeply missed. An update today on the case count. We have 24 new cases to announce in Harris County outside the city of Houston, and one more death. Overall, we're approaching 25,000 cases in Texas. We're at over 5,700 cases in Harris County, including the city of Houston, and we now have over 90 deaths within our county. So we're still watching those numbers very, very closely. We have two pieces of news that I wanted to share with folks today, designed to really flood the zone with additional capabilities. Testing has always been a key component of our strategy to be aggressive in combating this crisis. And today I'm going to share how we're going to use it to get ahead, to be proactive, to be aggressive, to stay in front of this virus. We've been working relentlessly from day one to try and make testing more accessible. The steps today are steps. The work continues, but know that we are on the phone, that we are checking options day and night to try and get to where we need to be. And so last week, we announced the great news that after weeks of conversations with FEMA, they finally allowed us to take our testing materials out of the fixed sites and into where folks most need them. And we are so grateful for their support, which has allowed us to take the step we're taking today. We all have heard of the stories in senior centers, in nursing homes. There was a report last week that as many as 1 in 4 deaths from COVID-19 are somehow linked to senior living facilities in this state. Imagine that impact. That is unacceptable. And in some ways, these facilities are a path of least resistance for the virus. Wherever folks live in close contact in groups, domestic violence shelters, homeless shelters, these senior living facilities, folks are like sitting ducks right now, and we can't allow that. We're not going to allow that anymore. So today we're announcing a new COVID-19 testing strike team. The strike team will be comprised of county epidemiologists, public health experts, and testing staff that will be deploying tests to facilities at high risk of coronavirus spread, at high risk of outbreak, to try and contain the virus in its tracks in those facilities where there's more of a possibility that it'll spread. Upon arrival, our team will work with facilities to conduct a site assessment. They will issue control orders if necessary, make recommendations to the extent possible, and they'll have the ability to test residents and staff in those facilities. Beginning tomorrow, Tuesday, they will be conducting that outreach, starting with nursing homes, and they will be ramping up. So they're starting with 1 nursing home a day. They're prioritizing those which have cases, but the idea is to ramp up this effort and to try and prioritize as much as we can. It's just the beginning. We're starting with that 1 strike team. We're going to expand as resources allow. The goal of this is of course to save lives, but to go on the offense. And the more we're able to do this, the better we'll be able to choke off the virus, stop it in its track, and move forward. This prepares us ultimately for the next phase of this, to take the tests to where they need to go. That's what we're doing. The more tests we have, the better we do that, and so that's why we're still pursuing options for even more tests. We're in communication with the city of Houston on this, and they are developing the details as well. The second announcement today, and it relates to testing, is we're proud to be able to double the number of pop-up testing locations from 2 to 4. So we already have 2 fixed locations in Katy and Baytown. We have 2 mobile locations, and now we're going to have 2 more for a total of 6 sites on top of the strike team that we're going to be sending to these congregate care facilities. So this week, the first 2 mobile locations will spend Monday and Wednesday at Tomball and Southeast Houston, and they will spend Thursday through Saturday in Southwest Houston and Crosby. The 3rd and 4th mobile site, we will announce the locations. The county commissioners, the precinct commissioners, and staff are identifying where they're most needed, and I'm grateful to each of the commissioners for their partnership on this. Look, we're a big county, and we need to make it easier for folks to be able to get tested. One part of it is ensuring that there's not that barrier. We're also working folks who do not have transportation to be able to take the test directly to them, to their homes. So we're doing everything we can to reduce that limitation. In particular, as soon as we're able to contain and begin doing more thorough contact tracing again, it's going to be imperative that we take the test to the people who've come into contact with those who've tested positive. And so this is a key portion of our proactive strategy for the next phase. We'll have a map later this week on Ready Harris that folks will be able to see in which part of town we have the different mobile sites. And of course, when they call, when they do the screening, they'll be directed to the one that's most convenient to them. Let me close by reminding folks that our public health intervention on face coverings began this morning. This weekend, I saw so many people wearing coverings, some of them quite beautiful, I might add. And I just want to remind folks that you don't need to leave your house to get a face covering. We don't want people scrambling, where do I get one? You can wear a t-shirt, make one at home out of a t-shirt or cloth. You can use a scarf, you can use a bandana. The idea is simply to cover your nose and mouth. And so no need to rush out and worry about buying something, just whatever you have on hand. I don't expect to hear about fines being issued, and I want to make clear that to the extent fines are not issued, that doesn't mean we didn't succeed. That's never been the measure of success. Every single order we've had, from the stay home, work safe order to the bars and restaurants, and now masks, there's been a fine attached to it. The first 2, the bars and restaurants and the stay home, work safe order, also carry jail time. But police, as far as I know, haven't issued one citation or arrested a single person in relation to any of these orders. The prioritizing of education is nothing new. I've said it time and time again every time we've issued these orders. And as soon as police have showed up, folks have done the right thing, which is why they haven't needed to do anything more. Our community has stepped up. They've flattened the curve. They continue, and we all continue to do our part. And so to the extent that education continues to work, great. And I really want to caution folks not to measure success in terms of fines issued, because in that case we would have failed already. None have been issued as far as I'm concerned on any of the orders, because folks have done their part. Now, that doesn't mean that fines are not a possibility. As I've said, this is not a police state. We prioritize education, but we need to make the order enforceable. For the same reason seatbelt laws are finable and enforceable, or parking in handicapped spaces is finable and enforceable, is to show that it's not a recommendation, but it's a requirement. This is about protecting life, protecting safety, and we have to send the signal that it is not optional. But that doesn't mean we go out there and find people to arrest or find people to fine. I know this is uncomfortable. I'm having to, pull my mask up here every once in a while. It is day 34 of the stay home, work safe order. And that is 34 days of saving lives. This is not just a throwaway line. It's the reality. Each of you at home, each of you wearing a mask, you are protecting other people. You are saving lives. You have saved lives. You've saved thousands of lives. And so I just want to thank everyone for their patience, for their sacrifice, for all they're doing. And I'll conclude with that. I'm going to repeat my remarks in Spanish, and then we'll hear from Dr. Shaw very briefly, and then allow for some questions.
You've been listening to Harris County Judge Lina Hidalgo announcing the creation of a new COVID-19 testing strike team. There's going to be a big focus on senior centers and nursing homes in our area to get out to these facilities to make sure that the staff and residents there are being tested for COVID-19. They're going to start tomorrow with one nursing home. They'll do one nursing home day by day so that they can get a better idea of what the spread is like in these facilities, Christine.
Yeah, so they'll start with one nursing home or assisted living facility a day and then go up from there. She says the goal in announcing this testing strike team is to save lives here. She's also announcing that the county is doubling mobile testing sites from 2 to 4 different locations. We'll have those on our website, clicktohouston.com. But again, the underlying component here is the need for additional testing as we work to flatten the curve of the coronavirus.
And this is in lockstep with what we heard from Houston Mayor Sylvester Turner this morning, where he announced a new city testing site at the Barnett Sports Complex. The push, the idea is to get into these underserved communities where people who want to get tested can't get tested because perhaps they don't have transportation to get to one of these testing sites. So that's sort of where the tide has been turning over the last several days, is to really make sure the most at-risk and vulnerable residents in and around the city of Houston and Harris County get the testing they need. So again, this testing data, as it continues to develop, will play a critical role in how the local economy here, Christine, is reopened.
And Andy, you mentioned the mayor's press conference that we heard from just about an hour ago, and talking about the vulnerable communities. We know we're expected to hear from Governor Greg Abbott this afternoon. He's expected to announce further plans to reopen Texas, but Mayor Turner really wanted to ensure that those in our vulnerable communities don't get left behind in the process of reopening the state. We obviously are going to be anxiously awaiting what the governor will be saying in terms of how to safely reopen the economy. But as in the meantime, listening to other leaders like Judge Lina Hidalgo talking about the increased need for testing, and that is just a streamlined across the board message that we've heard from all leaders locally and nationally, how important testing is.
And County Judge Hidalgo also addressing the mask order that went into effect at midnight, saying that this isn't a police state and the purpose of this order isn't to go out and issue citations to people. She said this isn't a recommendation, this is a requirement. She wants to send the signal that this is not something that's optional, but said that the measure of success of this order will not be based on fines. Christine?
No, it's not, but there is a fine in place because it does need to be enforceable, just like wearing a seatbelt is enforceable. Wearing a mask is enforceable. So beginning today, again, that mask order in Harris County went into effect, will be in effect for the next 30 days. Anyone over the age of 10 is required to wear a face mask in public. There are a few things in place where you wouldn't have to wear one if you have an underlying health condition or something like that.
I want to get back to the testing sites that we've been talking a lot about. The third testing site opening up in the city of Houston. This is in conjunction, a partnership with United Memorial Medical Center. The first testing site that was opened up through Congresswoman Sheila Jackson Lee. So the city now partnering with outside agencies to get more test sites up and running. The city's testing site is open to anyone with or without COVID-19 symptoms. You just have to pre-register ahead of time before you go out to one of these locations. A few days ago, back on Friday, Mayor Turner and Dr. David Pearce also talking about opening up another testing site in an underserved area of Houston, that being Houston's East End. We're expecting to hear more on that sometime this week.
And going back to the mask order that is in effect, trying to figure out that word exceptions is what I was trying to figure out. If you can't wear a mask, Judge Hidalgo says the order will make exceptions for people with health or mental health conditions who have difficulty wearing facial masks, as well as other exceptions will include people who are driving, eating, or exercising alone. Again, that is part of the mask order that is now in effect throughout the county. Anyone ages 10 years or older required to wear a mask as we try to flatten the curve here in our area.
And you talk about flattening the curve. We've heard from Harris County Judge Lina Hidalgo as well as Houston Mayor Sylvester Turner saying that the curve essentially has been flattened, but it doesn't mean we're out of the woods yet. Flattening the curve, that data that determines whether the curve has been flattened, a lot of that data in terms of the city's perspective is coming from hospitals in the Texas Medical Center. And what that means is that these hospitals are reporting that they're able to handle the volume of COVID-19 patients who are coming in, that they're also able to handle the demands for ICU beds as well as the demand for ventilators. In terms of hitting the peak, Mayor Turner said on Friday, we haven't necessarily hit our peak, but we are just about there. That being said, the mayor, the county judge, as we've heard her say this morning, still encouraging social distancing and to stay at home if you can.
Yeah, certainly. If you're just joining us right now, Harris County Judge Lina Hidalgo is providing an update on the county's response to COVID-19. She's announcing 24 new cases of coronavirus here in Harris County, with one new death being reported today. And she really talking about testing being a key component in our strategy to combat COVID-19. She announced 2 new efforts made in terms of testing here in Harris County, a new COVID-19 testing strike team. They'll be deploying tests to high-risk residents and staff in places like nursing homes, and they're going to be starting with 1 nursing home a day and then ramp up their efforts from there. She says the goal here is to save lives. She also announced the effort in doubling mobile testing sites. So now the county will go up from 2 mobile testing sites to 4 locations.
And we talk about this strike team going out to senior centers and nursing homes. This is something the city of Houston is ramping up as well. And the county judge and the mayor have been in discussions about working on this type of program together. The city announcing on Friday that they're going to be conducting visits to area nursing homes and senior centers within the city limits with the help of Houston firefighters who are essentially volunteering their time to get out to these facilities because the Houston Health Department just doesn't have the staff to conduct the number of visits that it would like. So this all speaks to the push, the groundswell that's taking place here in the greater Houston area to ramp up testing as we move forward with reopening the state's economy. The big focus, of course, as we've been reporting, is in these underserved communities where folks are considered to be at risk, more vulnerable to developing COVID-19, to catching the virus. A lot of these folks don't necessarily have the means, the transportation means to get to these drive-through testing sites that are now all over the city of Houston and Harris County.
Certainly, and Mayor Harris County Judge Lina Hidalgo made an interesting point in her press conference so far. She said in the state of Texas, 1 in 4 deaths are connected to nursing homes. So talking about our vulnerable communities and the need for increased testing and the ability for those residents and the elderly to get tested during a time where our communities and our country are trying to really flatten the curve. So that's part of the goal of this testing strike team that the county is announcing, to really go towards our vulnerable communities, make sure they have the resources, the testing, the help that they need, because with 1 in 4 deaths, according to Judge Lina Hidalgo, 1 in 4 deaths being connected to nursing homes in our state, that's something that obviously needs to be addressed, and that's what the goal of this is.
And with the state's economy set to reopen in phases, which we are starting to see happen, we're expecting to hear more from Governor Greg Abbott this afternoon at 2:30. Texas, keep in mind, reportedly ranking near the bottom when it comes to testing. You know, we've heard our elected leaders say repeatedly we are not where we need to be. We heard Congresswoman Sheila Jackson Lee mention that this morning, as well as the county judge and Mayor Turner. The mayor telling us on Friday that more public-private partnerships are needed to expand testing capabilities at public testing sites. Again, this as the curve has flattened in the city of Houston. There's also a push for more mobile testing units in a lot of these underserved, low-income neighborhoods where, again, residents don't have the means to get to a testing site. The mayor also reminding us, just like we've heard from the judge this morning, just because we've plateaued, it doesn't mean that the virus still isn't here. Our elected leaders saying that we should be testing 3,000 to 5,000 a day to prevent a surge in cases as the economy begins to reopen in phases. And Christine, as we've been reporting, we are just not there yet.
And we are expected to hear from Governor Greg Abbott to further announce his plans to reopen the economy, reopen the state of Texas. That's expected in just a few hours, around 2:30 p.m. today. Anchor Chris Gutierrez is going to be in Austin for that press conference. He will have live reports coming up later this afternoon, but a lot of anticipation surrounding what the governor will be announcing today as we continue to try to flatten the curve in Texas and nationwide. And we've been hearing from local and state leaders about the importance of testing and the importance of everyone continuing to social distance. And the next step that we're seeing is today with this mask order that the county judge has put into place. So she made that announcement last week saying everyone over the age of 10 is now required to wear a mask in public places. There are exceptions to eat, to drink. If you're in your car, if you're outside exercising alone, you don't have to wear a mask there. Or if you have a health or other medical conditions, that is one of the exceptions. Otherwise, it is a requirement. It is enforceable with a $1,000 fine. She did say earlier in this press conference that the measure of success with this mask order is not defined by the fines that will be given out. Her hope is that everyone will abide by this order, wear a mask in public, with the overall goal, Andy, just to continue flattening the curve. We sound a little bit like a broken record at times, but that really is the goal here as we continue to try to reopen our local economy.
All right, let's listen back into the news conference.
Your support of our public health mission, I really want to thank you. I also want to just thank our community. Let me start by saying Dr. Umair Shah, the Executive Director of Harris County Public Health Authority for Harris County. And let me start by thanking our community. I want to join the judge in really saying thank you to everyone for everything that they have done to really help us fight this virus. And I think there were a couple of things that we've said throughout this entire pandemic, that there were two real issues that we were monitoring. One was really related to our healthcare system. The worry for surge in our healthcare system, the worry for an overwhelming number of people that might go into the healthcare system, and obviously that overwhelming surge would mean that we would see what was happening in other parts of the country or the world. And fortunately, we haven't seen that here, and I really want to say that we have been successful as a community, and we really need to give kudos to our community for all of us working together in order to be able to really fight this virus. The other number that we've been watching is the testing number. And so while that first hospitalization number gives us a severity of how sick people are when they are needing to, when they get COVID-19 or needing to get care, the second number is the number of testing that's happened in the community. Our department has tested over 15,000 people at our several mobile sites, as well as the two FEMA sites that the judge mentioned. But I think the theme today is really testing. And testing remains an important piece of this, because as we test, we start to determine where in our community things are happening, where we can really launch all of the different activities or implement the strategies in order to be able to continue to fight this virus. And so as the judge mentioned, that our online tool remains live. It's at readyharris.org. readyharris.org, and we want to make sure people go to that online screening tool to get tested at our Baytown, Katy, as well as our mobile testing sites that the judge mentioned we're now expanding later this week. So it's going to go from 2 sites to 4, plus the Baytown and Katy fixed sites, as well as the phone number, which is 832-927-7575, 832-927-7575. And what we want to say is that the theme is testing. If you have symptoms, especially we want you to go to get tested. But if you do not have symptoms, but you feel that you have been exposed, or you want to get tested to make sure that you have not gotten COVID-19, we want to make sure that you go to our online tool or call. Now, the judge also mentioned this launching of the strike force. We call it the multidisciplinary team strike force, and that strike force is made up of epidemiologists, clinicians, social workers, data people, as well as our environmental health folks. We want to make sure that they have the ability to be able to go into various settings, including congregate settings, as the judge mentioned. Why is this important? This is important because we've already seen over 50 cases in nursing homes in our community, and across the country we've had over 10,000 deaths that are related to nursing homes across the country. And it's absolutely critical for us that we do everything we can for those who are most at risk, and certainly seniors, those with underlying medical conditions, rise to the top. And we have over 500 nursing homes and long-term care facilities, et cetera, in our community. We have to do everything we can to continue to protect those who are most at risk. And so that's where the strike team comes in. And also, if you contact the readyharris.org tool or 832-927-7575, if there are individuals who are not able to get to any of our testing sites, we can actually make arrangements for even potentially for homebound people to come to their homes. And so we want to make sure that that's also clear. We do not want any barriers for testing in our community. One last reason why testing is also important. The CDC just this weekend added 6 new symptoms to the list of symptoms for COVID-19. It was before shortness of breath and cough and fever. Now it includes chills, shaking from chills, muscle pain, headache, sore throat, and this loss of smell or taste that we've also seen in reports. So we want to make sure that as you have these additional symptoms, or you have one of those symptoms, or it's not just fever or shortness of breath or cough, that we want you also to be thinking about, I need to get tested. And that's why testing is such a critical piece to this. And the last thing I'll say about testing is that we know that testing constraints continue in our community. We have right now ample coverage and ability for our testing sites to handle testing in our community. Right now, if you want to get tested and you go to our Baytown, Katy sites, the line is almost nil. It's 20-30 minute wait and you're through. This should not be a barrier that you do not want to get tested. Everyone can get tested. Please get tested. We want to do whatever we can to understand this disease in our community and to protect all of us and all of you. Thank you. Judge.
Thank you so much, Dr. Shaw, and to the entire public health team for building the strike force, all these testing sites. These folks are working literally day and night to try and get the communities the resources it needs. So thank you to you and your team. We'll take some questions now.
Good morning. The first question is for Judge Hidalgo. Why not walk back the fine if both law enforcement officers in the city of Houston and in the county say that they're not going to fine people or issue a fine? Why not cancel the fine, as if most people who can't afford a mask likely won't be able to afford a $1,000 fine?
So the community has been fantastic so far with all of our orders, from the stay home, work safe, to the bars and restaurants, to this order we'll see, but I trust they'll be good in terms of complying with these requirements and there not being the need for enforcement. But that doesn't mean that enforcement shouldn't be present. And so that's why I want to stress, some folks are trying to make a political statement out of saying we're going to prioritize education. That's what I've been asking for all along, not just with this order, to be clear, with all orders. Folks can go back and check. Every time we've issued an order, I've been incredibly clear. This is not a police state. We need to prioritize education. I believe and I hope that the enforcement will not be necessary. This is about life and death. If you don't wear a mask, it's not about you. It's about the people around you. You might get somebody sick. You might kill your grandma. You might lead to the death of somebody who is immunocompromised, who lives with the person you were hanging out with without a mask. So this is something serious, and that's why we need to make clear that it is not optional. And so, yeah, we would ask, please. We tried that 2-3 weeks ago. You know, the mayor and I went out. We said, look, we're wearing masks, just as the federal government recommended. Please wear them. And most people did, but not enough. And so for the sake of our community's safety, for the sake of saving lives, we needed to make this mandatory. The fact that there is a fine doesn't mean that folks are going out there proactively and issuing fines. That's not been the case, not with this order, not with any of the other orders. That is not new. And so folks saying, I'm not issuing fine, great, thank you. That's what I asked you to do. But that doesn't mean that we shouldn't have that provision there. And so we do ask folks that they wear the mask, because this is not a matter of convenience. It's a matter of life or death for people.
This question's from ABC 13. It says the governor is expected to talk about opening up some businesses and give a timeline. It could be as early as early May. What are Dr. Shaw's feelings on that? Is it too soon, Dr. Shaw?
So we've been working very closely with the governor, and I look forward to seeing what he'll announce later today. Did you have something to add?
Yeah. Thank you for that. You know, I think what we want to just continue to stress, and the judge just said this, is that we are working with our federal, state, and local partners throughout this entire pandemic. We cannot do this alone. We have to work together. And I think the key message for all of us is that we have made a tremendous amount of efforts in this community, sacrifices that our entirety of the community has made, and we want to make sure that we don't go back on anything, and that we don't undo that fantastic work that has been done. So far, we are optimistic and we're hopeful, and we're continuing to monitor that what's happened in our healthcare system continues to be what remains in our healthcare system, that it's manageable, that they're able to handle the number of people that come through. The judge has said this absolutely the right way, which is we're continuing to work with our state partners. And I know that our governor and our state health officials are very much also concerned about what's happening in Harris County. And certainly they're going to do everything they can to also work with us. From our standpoint, reopening is all about, from a public health standpoint, reopening is all about being methodical, reason-based, and make sure that we do not undo any of the work that we have done, because that is absolutely critical to saving our community, not just now, but a couple, 2 or 3 weeks from now, when obviously people are now coming together.
You've been listening to Harris County Judge Lina Hidalgo updating the county's response to COVID-19. The judge announcing the creation of a new COVID-19 testing strike team. It will be made up of epidemiologists and clinicians. Its main focus will be to go out to these senior centers and nursing homes in our communities that have been identified as at risk for COVID-19.
The county judge also announcing an additional 2 new mobile testing sites for the county, bringing the total number to 4 and 6 in the entire county, with the 2 fixed locations in Katy and Baytown. We will continue streaming this online at clicktohouston.com. We'll be right back.